joint hearing of Senate Health and Welfare and House Healthcare. We've invited you here to talk to us about issues with access to healthcare. As you know, we're, at least in Senate Health and Welfare, we are considering a bill called Universal Primary Care, looking at a way that we can arrange for everyone to have access to primary care, and so we're interested in hearing your experiences to getting in the door for health care.
Thank you, Claire. Again, welcome to the State House. This is an opportunity for us to listen and for you to share what you want us to hear, share your stories. Again, as Claire said, each witness will be given up to 3 minutes. What I'd like to, let me also mention that while Claire's committee is taking up a bill on universal primary care, our committee is also involved in looking at issues of affordability, hearing from the Office of the Healthcare Advocate, and looking at issues that are impacting Vermonters' access to healthcare. I'm tempted to give a little speech, but I won't. Just to somehow say that many of us share a common goal, and for many of us it's a question of how to get from here to there. We have adopted Statute Act 48, that is state law, which talks about access to universal health care for all Vermonters. And we are here tonight to hear from you, to hear how we can move ourselves forward in this journey. So what I'd like to do now is to welcome each of our committee members just to introduce themselves by name and the community that they live in or represent. And if we can quickly use this to go around, I think it'd be good for you to know who we are.
Ann Cummings, I'm a senator from Washington County.
Ann Donahue, representative, Northfield and Berlin.
Lori Houghton, representative, Essex Junction.
Brian Chino, representative from Burlington.
Dick McCormick, I represent the Windsor County Senate District.
Sarah Copeland-Hansis, representative from Bradford.
Anne Marie Christensen, representative from Chester, Weathersfield, and Cavendish. Sorry.
Ben Jickling, I'm a representative from the Randolph area.
I'm Tim Brigland. I'm a representative representing Norwich, Thetford, Stratford, and Sharon.
Representative Doug Gage from Rutland City.
Senator Janine Lyons, representing Chittenden District. Senator Debbie Ingram, also from Chittenden District.
Hello, my name is Leslie Jacobson and I live in Bennington, and I'm a member of Rights and Democracy. I've lived in Vermont for 40 years, but this is my very first time inside the State House. I came here today because I believe our healthcare system is in crisis. Prices are out of control. Insurance companies are a nightmare to deal with for patients and doctors alike. And not all Vermonters have access to or are able to afford the care that they need, as we have heard this evening. I am a retired teacher. I have been fortunate to have good health care coverage. I'm healthy because of the good care available to me. But unfortunately, again, as we have heard here this evening, this is not true for all Vermonters. Just the other day, a friend of mine in Bennington was in line at the pharmacy. The person in front of her needed to have a prescription filled. When he was told the cost of the medication, he left it on the counter. He was unable to afford it. Was that a life-saving cancer drug? I don't know. But even if that medication was for a seemingly small problem, like a cut that had become infected or an abscessed tooth, not taking the medication may have led to major costly complications. There are numerous stories to be told of personal hardships stemming from the healthcare crisis, but time is short this evening. So instead of relating additional accounts, I will emphasize what can be done to help alleviate this urgent situation. We need your support to implement Act 48. the Vermont bill that was passed into law in 2011. It is the bill that would provide necessary medical care for every Vermonter, universal care. It would include treatment for eyes, ears, opioid addiction, mental health, and dental care. With healthier Vermonters, we will have a healthier Vermont. We would all benefit, medically, socially, and economically. This is a moral imperative. Do we care for each other or not? Without our health, nothing else matters, and any one of us could face a catastrophic medical condition. There is a workable financial plan to implement Act 48, and I'd be happy to supply this to you upon request. Historically, Vermont has led the way on so many important societal issues. Help us add universal care to this list. Thank you.
All my relations, and I use this traditional occultic reading because the subject of healthcare is one that lends itself to that. We're talking about, we are all related. We're all human beings. We all suffer. We all have the frailties of human beings. And there have been a lot of articles in the press lately, don't know whether they're true or not, that say that our legislators feel that healthcare is not a priority for the people of this state this year. After all the things that are happening in Washington, Medicaid cuts, attempts to repeal the ACA, even things like no funding for CHIP, trying to cut Medicare, and work requirements for Medicaid that even our neighbor of New Hampshire is adopting. How could healthcare not be a priority for the people of Vermont? I know that you can embrace your common humanity, and I know that you've heard tonight, and that you probably hear every day, and may have personal experience with human suffering. We are all in this room healthcare justice voters. We oppose all the cuts I just mentioned. We support Medicare for all on a nationwide level. In fact, very shortly, in 10 minutes, Bernie will be starting a nationwide talk on Medicare for all. We support universal care here in Vermont. We support LGBTQ and reproductive health care. We support mental health care, care for substance abuse. We support paid family medical leave so that we can take care of our loved ones, as we all know we should, because we are all related. So, as healthcare justice voters, we ask that you throw away the concept of scarcity, fear, and austerity. We ask you to embrace the concept of abundance, humanity, compassion, and justice. We ask you to let us help you be healthcare legislators.
Good evening, my name is Charlie Murphy, and I work as a peer advocate counselor with the Vermont Center for Independent Living down in beautiful Bennington. My testimony is going to be a summary of 3 of the 4 written testimony that I brought with me tonight. My first peer is Tracy. Tracy has waited years for a program called Medicaid for working persons with disabilities to take effect. It has. She applied for it, and she was deemed ineligible because her asset level was over the amount that allowed her to be eligible for the program. She hopes to spend it down over the next year, but meanwhile, the high deductibles, co-pays, and the so-called Medicare Part D donut hole has prevented her from time to time to buy the necessary diabetes medication, which recently resulted in her going to the ER to determine whether she had a stroke or a blood clot. My next peer is Angela. Angela is slightly over income for Medicaid, community-based Medicaid. She has to go through an out-of-pocket spend down to become eligible. She's eligible for 6 months, and then she's off. While she's eligible, Medicaid pays for Medicare, deductible, and co-pays. and then she has to, be off the program until she's eligible again, and does another out-of-pocket spend down. One of the things that is affected as a result of this, among others, is her Medicaid-based transportation, which she relies on for her numerous doctor's appointments. This instability, coupled with other related stressors, negatively affects her PTSD and her severe anxiety disorder. My next peer is Michael. Michael was hit in a crosswalk down in Bennington by a drunk driver and left for dead in the middle of Elm Street. He survived the accident with numerous injuries as well as a partial leg amputation. Over the years, he's needed dentures to help with the nutrition that he needs to keep healthy skin and heal wounds. Dentures can cost anywhere from $3,000 to $5,000, depending upon the dentist you go to. There are other cheaper, less expensive options, but you get what you pay for. Finding funding for dentures is close to impossible, if not impossible. That's why I feel that our healthcare system is fragmented. It's a patchwork of programs. We need universal health care. Act 48 needs to be implemented fully and equitably financed, public financed. And in closing, I want to say healthcare is a human right, and thank you for this opportunity.
Prepare too many remarks, but my name is Jessica Morrison. I'm the member of the Vermont Merker Center, and I'm also a nurse practitioner at Trillium Integrated Medicine in South Burlington. I'm a primary care provider for some of my patients, and I also do functional medicine and integrative medicine consults with patients with chronic complex health conditions. I really love what I do, and I think we do something really special at our practice, and I really want that care to be accessible to people. I hate it when I order labs or prescribe some other type of care and it's not covered by insurance. A lot of my patients have really high deductibles and copays, and when they realize that they're going to get a $500 bill from a couple visits, then they stop coming, and that's the reality. And from my point of view, insurance companies' main job is to deny care and waste my time, time that I don't have, and I want to be spending on patient care rather than prior authorizations, and the hours of daily documentation it takes to get paid for our work. I think universal primary care could be a step forward, and I'm pleased with the mental health coverage, but I don't think it's enough. As a PCP, I really can't do it alone. I do rely on referring to specialists and hospital care if that's what someone needs. I don't want to say, oh, I think that you might have cancer or some other serious illness and not be able to see that through with someone, or that care might cost them a lot of money or bankrupt them. I think preventive care is really important, but people shouldn't be penalized for not having the access to the social determinants of health that keep us healthy. It's not just medical care, it's a lot of other factors that keep us healthy. I don't think we can afford half measures or false solutions that don't get to the root cause of profit in our healthcare system. We need to get the profit out of insurance companies, pharmaceutical companies who are profiting off of our healthcare. We have to finish what we started with Act 48 and fund it equitably, publicly financed healthcare. We still have the bill on your books, and we call on you to have the courage and leadership to pass that. And to do better for us as patients, as providers, and everyone here in Vermont. So thanks.
Hi, I'm Tom Jocelyn of Jericho. The draft of H248 from last year specifically excludes dental services from the legal definition of primary health care. Should that definition clearly include preventive dental care as well as vision screening and hearing screening? I'm asking because what happens to our teeth and gums and eyes and ears affects the rest of our bodies as well as our overall well-being. Thank you.
Hi, I'm Ellen Axfeld from Middlebury, Vermont. I have good health care and a very good job. I have never ever understood or accepted that my neighbors and my fellow Vermonters don't have what I have for no reason other than that we have a crazy system. You've heard in an unfair system. You've heard in agonizing detail the suffering of Vermonters who do not have access to health care. I'm here to support H248 and S53, universal publicly financed primary care, as a first step, an essential step, a simple step, and an inexpensive step. You know why primary care comes first. You've heard how it saves money and detects problems sooner. That doesn't mean it's the last step. We've heard all about that tonight. Why universal? Because this is a point other people have not yet raised. We Americans don't do very well with charity. We don't like to pay for other people if we're not suffering. That's a terrible thing to say, because you've heard a lot about suffering tonight. But we Americans do very well with solidarity. When we're all in one pool together and we all have the same thing, we support it. When the rich people and the healthy people, who are not necessarily in this room tonight in large numbers, all have primary care from that same universal primary care trust funds that all the rest of us have it from, they'll support it. It's like Social Security. I don't want to say untouchable, because some people want to touch it, but it's hard to touch it, because we all know we'll get it. That's why your first step in the implementation of Act 48 has to be a universal one. And why not start with primary care? Okay, second objection, complication. You guys have thought through all kinds of far more complicated things in the past few years. The Affordable Care Act is very complicated. Platinum, bronze, silver, gold, right? Subsidies, non-subsidies, qualifying, not qualifying. The all-payer model, and the ACOs supposed to coordinate care and make people healthier even though it doesn't guarantee access. These things are extraordinarily complicated. Universal primary care is a simple idea. Okay, I have 29 seconds. There are few little things you might have to figure out. They're not insurmountable. How do you ask, the ERISA question, questions about HSAs? There are wonderful experts who can help you through. I hope you will ask Herb Olson to testify to both of your committees. These things can be worked out. They're much simpler than ACOs, APMs, and gold, silver, platinum, and bronze. Thank you very much.
All right. My name is Walter Carpenter. I am 62 years old and live in the city of Montpelier, Vermont. Most everyone who knows me inside and outside this building knows that I am an activist for universal primary care. While I would like to see us take Act 48 off the shelf, shine it up, and implement it like we should, I am fighting for UPC. I'd like to ask everyone in this well, and for that matter beyond it, a question. I apologize to the more veteran members of these committees for regurgitating a story they may have heard before. How much are you worth? In other words, how much would you spend to save your life? Is it $20,000, $40,000, $80,000, $200,000? You have no insurance, you need the operation, or you will certainly die in the excessively near future. In 21st century America, in 21st century Vermont, I had to make this choice. This dreadful decision could easily have been prevented with timely access to a primary care physician. When the disease first manifested itself, I was working for a Vermont company and surprisingly even had it. Yet, like so many companies, this company was owned by a parent and we had to subordinate ourselves to it. The parent suddenly changed health insurers just as the symptoms were coming on, and in one stroke, my primary care physician was pushed into that void called out of network. Sure, I could visit this doctor, but only if I plunked down the hundreds of dollars of the uninsured rate. The new insurer lacked primary care providers in Vermont. The nearest one was probably in St. Johnsbury, about 60 miles away. I had to struggle to find a primary care physician, and when I finally did, it was almost too late, and I ultimately had a price on my life. I understand all the bizarre complications to UPC, difficulties that often seem more complex than the Apollo moon landings. We spend $6 billion and more annually for healthcare now. Some $2 million of that goes to just one healthcare CEO. We can do UPC. We can We did it as the first state in the Western world of the 18th century to abolish slavery. A sign out front here testifies to the state's courage in being the first to defy traditional norms regarding gay, lesbian marriage. We did it this week with marijuana. We can pass S53, H248. If we do, when we do, no Vermonter will ever again have to ultimately choose between medical debt forever or death for lack of a primary care physician.
Hi, I'm Tenzin, and I'm a critical care and cardiology nurse at the University of Vermont Medical Center. I see some of the sickest Vermonters come over to our floor and lay in the beds in front of me, and I want to make sure you all know that primary care is life-saving. Too often when we have the very sickest of those patients, what they tell me is that they haven't seen a doctor in years, decades, ever. And when it does come down to this bill, I want to make sure all of you know that with primary care, it's life-saving, and that just to, when it comes, I don't know if you sign a little box or push a yay or nay button, that button is the defibrillator button. It is your hands on that person's chest, and it's watching that EKG tracing turn to a flat line, so go for it. Thanks.
Trevor Leishman from Middlesex. I want to thank you for holding this important hearing at a time when working people can attend. Speaking this evening as a member of the Vermont Democratic Socialists of America, DSA, and our rapidly growing national organization is working with Senator Sanders and others to win improved Medicare for all. Not only Vermonters, but people across the country need you to get Vermont back on the track to guaranteeing health care as a human right. As a result of grassroots organizing in 2011, Vermont passed our Universal Health Care Law, Act 48, which put us on the road to universal and unified publicly funded system. But it left undone the mechanism for financing, saying only that it must be equitable. Vermonters and people across the U.S. were set back when Governor Shumlin, after multiple delays, announced that his financing plan was finally complete, but that the taxes were too high. By failing to fulfill his statutory obligation to send 3 financing proposals to the legislature, he not only short-circuited Vermont's progress, he provided opponents of universal health care nationally the opportunity to claim that single-payer had proved unworkable in Vermont. Debate would stop before it could even begin. The Healthcare as a Human Right campaign offered a detailed plan for equitable healthcare financing supported by over 100 economists, which we attempted to get a public hearing for. Finally, we have a public hearing years later. Thank you. Our report concluded, quote, Vermont has the ability and obligation to implement a universal publicly financed healthcare system. The Healthcare Human Rights Campaign's financing plan improves upon the governor's proposal with a more equitable solution for businesses' contribution to the healthcare system, thus making payroll financing economically feasible. Our plan sets Green Mountain Care on a solid financial footing and guarantees access to comprehensive health care for all Vermont residents. People will contribute based on their ability so that low and middle income people pay a smaller share of their income on health care than the wealthy, the opposite of the current system. I urge you to provide for updating our plan. Get us back on the road to universal health care. Vermont needs it, and the nation needs our positive, not negative example. Courage. Thank you. And here's a hard copy of the financing plan, and there's also a link where you can find all 37 pages of methodology there. I hope you actually take this seriously.
Thank you.
Yes, my name is Greg Sands, and I think you're going to hear a slightly different kind of testimony from me. So here's why. I'm just a blue-collar working guy. I've been that way since I could legally work. Warehousing, trucking, logistics. But I share a lot of the same stories. I've been moved by some of these stories that I've heard tonight, and honestly, you know, I've been doing it for about 20 years, and it's been It's been tough. You know, for nearly 20 years, I've required a really important psychological medication to ground me. And, you know, help me be the productive member of the community that I know that I can be, and I have been, and a good family member as well, and a productive citizen generally. However, the healthcare system as it stands now has made that very, very difficult for me to attain and to be the best citizen that I can be, you know, no matter what I'm doing with my life. So, you know, mental health support can be over $100 an hour and end up, you know, and I've always gone back and forth between no insurance, state insurance, and employer-sponsored insurance. For 20 years, it's been like fighting a battle because in order to get what I need, my co-pays have been unaffordable. Anytime an employer has offered insurance, it's been just too expensive. It's not an option. It's taken what I've worked really hard from the ground up, from minimum wage up to $11 an hour, up to 12, 13, 14, and finally when I hit 15, I'm teeter-tottering on the brink of either not being able to afford insurance or not being eligible for state subsidy anymore. And that's a battle a lot of people are fighting every day, you know? So I urge you guys, please, healthcare really is a human right, and I'm not, if you can see the honesty in my face, I hope you can. I'm not just regurgitating, you know, like media points or anything like that. It really is. And there are so many Vermonters that need you guys to look deeply into this and look into your hearts. And you know what the right thing is to do, and that's to pass Act 48. Thank you.
Thank you.
My name is Marjorie Power, and I'm from Montpelier, and lots of you have seen me for a very, very long time. Because I started campaigning for universal health care over 35 years ago here in Vermont, when I returned from nearly 20 years in a country that already had it. And it was a real surprise to me that I had to spend half of my income buying health insurance for myself and my children. I had trouble with that whole concept. Over these 35 years, we have had various impulses toward getting health care for all Vermonters. And every single time, we have choked. There's always some excuse. Too complicated, too da-da-da-da-da-da. You know them all. Many of you have lived through it. Now, it's become clear to me over those 35 years that we cannot, with a 2-year legislature and government, do it all in one bite. It'll just be choke, choke, choke. So here we are with the possibility of taking a major first step, one of the virtues of which is that it's really efficacious and really cheap. And so, you know, get universal primary care. Try it. You'll like it. And what's more important, Vermonters will like it. And as we've seen with the attempt to repeal the ACA, which everybody hated, they tried it. And they may not like it, but they like it better than the alternative, which was nothing. So we could give them an even better thing. And I know the excuse, well, we don't know what the feds are going to do. Everything is out of kilter down in Washington. Where will the money? We've been there, we've done that. It's time to ignore them and just move on and do what is right for Vermonters, by Vermonters, for Vermonters.
Thank you.
Hi, my name is Michelle Robbins. I'm from Essex Junction, and I'm just here with a quick reminder about how many people in Vermont are self-employed. We're living out the American dream, running our own businesses, taking care of ourselves to the best of our ability, and contributing in our communities. And for the most part, we don't have health insurance because we can't afford it. I am a massage therapist. For the most part, by trade, I work on a lot. I have several clients who come to see me. I am their form of healthcare. They're working more in prevention because they can't afford healthcare. It's cheaper to come see me on a regular basis than it is to pay for healthcare. That's all.
Hello, so my name is Kelly Schofield, and I'm here today to show my support and to speak out in favor of being able to utilize naturopathic physicians as your primary care physician. So the bill aims to provide universal access to primary care in hopes of reducing system-wide healthcare spending and to offer Vermonters access to primary care in hopes of preventing disease before it becomes more serious and more costly. I ask that you include verbiage to allow us to choose naturopathic doctors as our primary care. It would be an injustice to deny Vermonters the ability to recognize their naturopathic doctor as their primary care. So, like many others in this room, I spent many decades of my life as a mystery, trapped in the wheel of the traditional medical model, with a laundry list of symptoms slowly unraveling my world and raging out of control. Thousands upon thousands of dollars were spent on blood labs, trips to a specialist, and prescriptions, which all yielded with an absence of answers and began a battle against my own body. So for many years, I went without insurance because of affordability or lack thereof, so my symptoms festered. And like all primary care practitioners, not just my health is dependent on my naturopathic doctor, my life is dependent on her. I rely on her for preventative medicine, cancer screening, and comprehensive whole health care, all provided at a cost that I can sustain. The reality is I am seeking comprehensive, proficient care with lower costs, both out of pocket and billed to my insurance company. So my world is changing. I'm healing. I'm beginning to feel healthy once again, and I am now one of the lucky ones. But over half my life has been spent sick, and this should not be one's reality in a prosperous nation such as ours. The World Health Organization defined health back in 1948 as a state of complete physical, mental, and social well-being, not merely the absence of disease. The naturopathic physician combines the wisdom of nature with the rigors of modern science. Steeped in traditional healing methods, principles, and practices, naturopathic medicine focuses on holistic, proactive prevention and comprehensive diagnosis and treatment. But using protocols that minimize risk of harm, naturopathic physicians help facilitate the body's inherent ability to restore and maintain optimal health. It is the naturopathic physician's role to identify and remove barriers to good health, and by helping to create a healing internal and external environment. This is the model I believe in, and if we are to continue to seek out this definition of health and wellness, we must allow naturopathic physicians to be listed as one's primary care physician and also allow access to health care universally. It would be a disservice to deny Vermonters access to such valuable, rather invaluable care.
Good evening. First of all, thank you, senators and representatives, for hosting this hearing. I think this is the first hearing on healthcare that has been held since the dramatic change in plans Governor Shumlin announced at the end of 2014. So it's pretty timely, and a lot has changed since then. So I think there's a lot on your plate. I wanted to take cue from a previous witness who organized her notes in terms of the past, present, and future. So just a little bit of like a review of the past. In 2011, this body passed Act 48, which was supposed to bring about a universally accessible healthcare system. We were supposed to decouple health insurance from employment. We're supposed to expand access. We're supposed to make health insurance more affordable, more equitable. So for, people like state employees, it would matter if you earned $50,000, $60,000, or $70,000. You wouldn't be paying the same $200 per pay period if you earned $50,000, $60,000, or $80,000. It would be tiered more to, could you afford it? Would it be, what percent of your take-home pay would that be? Those are the principles in Act 48. So after Act 48, after Governor Shumlin decided he didn't want to go in that direction, the next legislative session, you guys passed something called Act 113. And that's what we're currently working under, is Act 113, which gave rise to what we call the all-payer accountable care organizational model. A lot of times people leave out that accountable care organization and they just call it APM, the all-payer model. But it's actually the all-payer accountable care organizational model. And I'm emphasizing that because our system does not have to be dependent upon an accountable care organization. This is the model in the all-payer model agreement, but changing the way we pay for healthcare, moving away from fee-for-service, moving to value-based payments, you don't need an accountable care organization, an ACO, in the middle. I think of it sometimes as like this third kidney in the sky, and all the money is going to go in there and then come out to the providers. Well, by all payers, we mean Medicare, Medicaid, and commercial insurance. Right now, I know for sure we've got Medicaid going in. I don't know if anyone has seen the contracts for the other two payers, but we need some protections for Medicaid, because Medicaid's in, and more of Medicaid, long-term care Medicaid, is coming in next. So my time's up. I look forward to talking with you more, but we got to get out of the all-payer model. We need an escape clause.
Hi, my name is Keith Brunner. I live in Burlington. I didn't prepare a long testimony. Mostly just wanted to make 2 points. And actually, Susan was kind of made the one point that I wanted to bring up, which is a concern that Vermont has shifted from leading the country in moving towards viewing healthcare as a public good and having policies that reflect that, and towards the direction of really, which is much of the country is going, is handing over our healthcare system to these increasingly unaccountable organizations. In this case, UVM Medical Center in Dartmouth. UVM is not necessarily a for-profit company, but I think in many ways replicates one. So I want to bring that in and share my concern that I'm worried that we are moving from leading the country in one direction to actually being kind of the vanguard in a different motion towards making our healthcare system less accountable and more administrators. The other piece that I just wanted to say is that I think there's a realm in which it's a question of ideas. Is healthcare a public good? Is it a human right? Et cetera. But I think that actually it's also a question of real material interests, and I think we ran up against that with trying to implement Act 48. There are individuals, there are organizations that are doing very well by the current way our healthcare system is set up, and finishing the work of implementing Act 48, getting back on that path, which I think it seems like a lot of people in the room and maybe a lot of people at the table are pointing in that direction. We're going to have to challenge those interests. And this is not something that's new. This has happened with social movements for human rights and justice in the past. But I think we should be prepared and we shouldn't be surprised when we get pushback and when there's tons of money flowing into our state with ads and all of the things. So I think there's a piece where, we're all looking to you. I think this is excellent that we're having this hearing, and we're all looking to you to kind of put out a little bit of courage and be willing to push back against all the folks who are benefiting from the way that the healthcare system is currently set up. Yeah, we'd like to see that, and we'll be out organizing and mobilizing and connecting. And the last thing I'd say is just that people support this issue. I think if you look at the support for Bernie Sanders in this state repeatedly, Medicare for All has been on the top of the list. That should be a barometer of where the public stands on the issue. So it's it's very popular. So I'll leave it there. Thank you.
Hello, I'm Senior Williams from the town of Barry. Thanks for all the time you all are taking tonight to listen to what we all have to say. I'm now on Medicare and Vermont Medicaid as being 69 years old. This would be a good start, this S53, but only having coverage for primary care and not specialists also, it seems kind of impossible for most people, especially as you get older and parts start to fail, like an old beater of a car. You find out the name of this part and what can be done, if anything, about it. I'm a dual eligible, as they say. I have Medicare from being disabled and old, and have Vermont Medicaid as my secondary payer. Living on Social Security of $1,120 a month, I'm a few bucks over the categorically eligible, so every 6 months I have to do this awful thing called the Medicaid spend down. And since my stroke in 2002 not only led to my having to quit work at 2008, but took away my stamina and made me very, very disorganized. So please hang in here with me for a bit. So the Medicaid spend down, yeah, that is many pages of overwhelming paperwork, and somehow I manage it now with some help from the Council on Aging. I see a podiatrist for my feet, a speech-language pathologist for around the brain damage and disorganization, a vascular surgeon that monitors my aortic aneurysm, a urologist, a dermatologist, radiologist. My arthritis is my worst overall thing, and I have 2 artificial hips. I'm still asking for an artificial spine and an artificial brain, because those 2 parts are not working very well, and I would really appreciate that. So my best care is from my cats. I pass into a state of kitty bliss, and whenever I need to get rid of my PTSD symptoms from childhood sexual abuse, and my cats are wonderful. Thank you.
Hello tout le monde, mon nom est Michel Cabé. I grew up in Quebec. I am a U.S. citizen. I came to the United States permanently in 1998. So I'm that dreaded thing, an immigrant, a professor of computer science and statistics at Norwich University. In 1972, I arrived in Hanover, New Hampshire to begin my doctorate. And the Dartmouth College insisted that every student have a medical exam. Fine, I went to Dick Hall's house and had the exam. And the administrator gave me a piece of paper. And on the paper it said $83. And I am not joking, folks. I looked at the paper and I genuinely thought, oh, isn't that interesting? They tell you how much the medical care would have cost. And I proceeded to turn around and begin leaving Dick Hall's house. And the administrator said, excuse me? Yes, you haven't paid. And I don't know if I can still open my eyes to the extent that I did, because my reaction was, you pay for medical care? What's next? Toll roads? Oh, sorry. What's next? Coin boxes to run the traffic lights? What's next? Little vouchers to pay the fire department if we have a fire in our home? What's next? Paying the policeman, oh wait a minute, no, paying the policeman to protect civil rights? Wait a minute, wait a minute. We're supposed to live in communities. We are supposed to care about each other, at least so many religions tell us. So what are we doing having payments for medical care that have no consideration for the disposable income of the people who live next to us? It is unjust, it is immoral, it doesn't make financial sense to push people into emergency rooms because they don't have preventive medicine. It's insane. Let's fix it.
Thank you. Thank you. Our next on the...
Good evening. My name is Christine Smith from Barrie. I am with the Vermont Worker Center. I take care of my mom. I've been doing it since I've been in high school. And she gets home health 3 days a week. I don't know if she's going to be on it long term. I don't know if she's going to land up coming off of it because of, money-wise. I have medical issues of my own that I deal with on a daily basis. I don't know if any of you know what non-epileptic seizures is. It's part trauma and part...
Yes, thank you. If you could bring the mic closer, we could hear you better. Thank you.
It's part trauma and part PTSD. I have to deal with that and include trying to take care of my mom. It's very hard for me to do this. If I'm not well, I can't take care of her. I don't want to put her in a nursing home because nobody can afford anything. This universal health care needs to be pushed forward so we can have it. This isn't fair for anybody in Vermont. But I do have one question for you guys to think about why everybody else talks. What would you all do if you had no health care? Think about what we all go through. There's homeless people that live out on the streets. I was one. I know how it is. I put a challenge out, I don't know, last year to the Green Mountain Care Board to leave your cell phones, to leave your cars, go live in a shelter, then come back and tell us how it is. Thank you.
Good evening and thank you for your time. My name is Priscilla Royer and I'm from Barrie. And 3 months ago, I was unpleasantly
Now we need to move the mic back a little bit.
I'm pretty good.
We have to make an adjustment.
I'm presently surprised with a heart attack. And with the grace of God, I'm here to give you my story. And I would urgently express that you support universal health care. It's an affordable need for all Americans and all Vermonters. Personally, I am not a native Vermonter. And some of you probably around here are what we call flatlanders. Well, I am a flatlander. and I came to Vermont in 1983. And since then, I've had some health issues. But with the grace of God, I have insurance, but I wanted to see that it's affordable for all. And somewhere in the future, maybe for my future grandchildren. I thank you for your time.
My name is Jamie McCallum. I live in Weybridge. I was one of the people who came to Claire with this idea of having this hearing, and I thank you so much for hosting it and for having us all here tonight. I know it's a late night for you guys. I got interested in this issue because of problems that were happening around me from friends and family, as other people have said tonight. I'm one of the lucky ones. I have one of those so-called Cadillac plans. I have a decent job that affords me that luxury. We all know that Cadillacs are nice when the sun's out, when the weather's good. But when it's a crisis, when it's raining, it's storming, and whatever, you need something better. This happened to me recently. Things were going well for me a couple of years ago. It changed. I started to go blind. I'm legally blind in my right eye now. I'm going blind in my left eye. It won't be long before I won't be able to drive in this state, unless I get the surgery. The surgery is expensive. It's very expensive, even for someone with a decent income. And all of a sudden these problems came to hit me, and people around me will be affected if this all goes down the way it's looking like it's going to go down. I'll have to get the surgery. It will cause me to have massive amounts of debt that will further impact the people around me. And I'm really I'm really worried about that. And so it's come to me, I guess, this issue has come to me more as an issue of let me just say clearly that I am in full support of the push for primary care, so long as it is, as other people have said it tonight, really a legitimate first step until truly universal care. The primary care situation won't actually help me. It will be important. It will be useful for lots of people around me, but I guess I'm still hopeful that we can hold out for something even better. Thanks so much for your time. I greatly appreciate you holding this hearing.
Hello, my name is Ivy, and I'm a student at Middlebury College. So my mom works as a primary care physician in my home state, which is Virginia. And unfortunately, she spent her whole career frustrated with the United States healthcare system. I can remember being a really young kid and overhearing my mom exclaim in exasperation that this $200 pill would cost $5 in France. I learned at a young age from my mom that an overwhelming number of procedures and medications are overpriced within our healthcare system due to the influence of profit-seeking insurance companies. Now that I'm older, I realize that our system has the potential to change. I believe that Vermont is lucky to be in the position to act as a role model for the rest of this country. I've personally never had to worry about my own health care. I've never been afraid that I won't be able to fill a necessary prescription, never avoided a necessary procedure due to a lack of funds. Sadly, as many others have said this evening, the same cannot be said for everyone. The cost of insurance prevents low-income folks from being able to get the health care they need. In our current system, the financial burden of healthcare falls disproportionately on people who are struggling. I'm unwilling to stand idly by in the face of this glaring inequality and inequity. If we institute a single-payer system, we can eliminate our dependence on insurance companies and make care the focus of healthcare instead of profit. This would increase the quality of care for all people. This is why I want to see the promise of universal health care set forth by Act 48 fulfilled in Vermont. Thank you.
Thank you for the opportunity to testify tonight about primary health care. My name is Mary Alice Bisbee from Montpelier. Now in my 8th decade, just starting, I have lived through many attempts to improve our health care non-system in Vermont. I even ran for state senate a while ago under single-payer health care was my in Washington County. The more money we seem to throw at the problem, the more new entities such as OneCare we create, the less effective it seems to become. Meanwhile, the CEOs and the other highly paid administrators are making out like bandits. My primary care provider of several years retired a couple of years ago, and I have had 3 new providers, none of whom really gets to know me or seemingly to care for my concerns in the meantime. Here today and gone tomorrow, sometimes not even living in central Vermont, shared positions with other Chittenden County entities, all under the umbrella of UVM-MC. Appointments are harder to get, and when I asked for a new provider within the practice, I was told that there are no other choices. There is a real shortage of primary care doctors in Vermont and around the nation. Could it be that medical students see the writing on the wall? There is no money in primary care, although these providers have perhaps the most challenging position, getting to know their patients and sending them in the right direction when specialty care is needed. I'll skip my personal Social Security drama here, and you can read it because I've submitted it. Universal primary care is spelled out in H248 and S53 could be an excellent way of providing real health care for all, a goal most Vermonters would like to see our legislature implement now. Let the insurance companies write policies that only cover specialized and hospital care and use a progressive tax structure to pay to provide universal access to health care at the start. Union contracts should not be dealing with primary care access, which should be equally accessible to us all, young and old, rich and poor, without co-pays or deductibles. Taxation with representation is not a dirty word.
My name is Griffin Shumway. I'm with the Vermont Worker Center, and I live in Wilder, Vermont. I was here in 2015 when the Vermont Worker Center took a stand in favor of universal health care and Act 48. And I ask you today to take your own stand in favor of Act 48. It's a law in the books, and it will help so many people around the state. I have 2 stories today to tell about my own healthcare woes. The first, my partner, who, because of a clerical error, lost healthcare about 2 years ago because of a clerical error. She found out when she went to see a doctor about headaches and dizziness she was experiencing while driving. She got Medicaid about a month ago. She's since seen an eye doctor, a primary care doctor, and is now being referred to an MRI and a CT scan. This is terrifying. This could have been dealt with 2 years ago had she had health care, but instead she chose to forego treatment because we cannot afford it. We found that this came about because we went to go see an eye doctor a week ago, an eye doctor that I have foregone seeing because the last time I went there, I was charged $400 for simple tests to test for glaucoma because it turns out I'm at risk for glaucoma. I've made an agreement with that provider to not do these tests every year, even though that's what the recommended treatment for is, because I cannot afford these tests. That's not covered in primary care, but it will be covered in Act 48 when you choose to fund it. A friend of mine, a former coworker of mine, left a family-owned business in Bradford to work with me because she needed health care. She's now back at that business because the working conditions were so bad and the pay was so poor that she couldn't afford to work there anymore. But she left that business just to get health care and work with me. It is obscene that in the wealthiest country in the world that we don't have access to health care, that we don't have access to our basic needs. I implore you all to fully fund Act 48. That's what we're here today for, and that's what you're doing. That's your purpose as serving the people of Vermont. Thank you.
My name is Jason Kay. I live in Middlebury. I'm a carpenter, currently working on a job in Rutland. We're building the sober house. Normally the projects I work on are mansions for rich people, and this sober house in Rutland is the most meaningful project I've worked on. And I left early today to come here. I want you to know that I am angry. I'm not here to yell or to cause any disrespect, but I am angry. The universal primary care bills currently before the legislature are a bluff. Act 48 of 2011 has already established in Vermont statute a universal health care program that explicitly names primary care as a required component. Governor Shumlin's 2013 financing plan for universal health care shows the true nature of this bluff. Under that financing plan, 93% of Vermont families would see an increase in their net family income and have health care. It is only the top 7%, the richest 7% of Vermont families that would pay more than they're paying now, and they'd have health care too. So when Governor Shumlin said that health care is too expensive, he sure as hell wasn't talking about the 93% of Vermont families who would see their net incomes rise. But that's only part of the reason why I'm angry. 4 of the 5 current members of the Senate Health and Welfare Committee were in office and voted for the legislation that became Act 48. So did the current chair of the House Health Care Committee. It's been 6 years, and you're considering to legislate another promise and another study. We've been here before. The answer we already know. In order to equitably pay for health care, the very richest are going to have to pay their fair share. And that right there, raising taxes on the wealthiest people in the state, is something that you all fully understand and from which you are running away. To the other committee members who may have reservations about a universal health care program, don't get lost in an ideological debate about the role of government. This is not a Democrat or Republican issue. This is, quite simply, a struggle between the working people of the state and the wealthy elite. 93%.
Thank you.
Hello, my name is Ann Vanneman. I'm from Shrewsbury in Rutland County. I'm a retired teacher and lucky enough to have great insurance. Lucky me. A lot of people here don't have it. So why am I so lucky? Because I belong to a union that fought really hard for many, 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 many years, and so we teachers have pretty good insurance. It's not fair. In thinking of health care for Vermonters, I tend to look at the biggest picture I possibly can. In the US, we have public highways, all publicly funded. We have publicly funded police and fire protection. We have public education. We have a military, all paid for with public funds. When we get old, we finally get Social Security and Medicare, and some of us with some extraordinary needs get Medicaid. It is time now to provide health care for everybody. We know that Europe and the Scandinavian countries have already accomplished this. They're just centuries ahead of us. And they've accomplished this provision for their citizens. So let's join the rest of the developed world and provide for all of our society. And let's let little Vermont lead the way and be responsible for ourselves and our neighbors. Thank you.
My name is Barbara Hoffman, and I'm from Shrewsbury, and my story is a little bit different. It's about the crucial role that a primary care provider can play in a person's life. And I don't think we should stop at just universal primary care, but for starters, the importance of a primary care provider is what I'd like to talk about. My son injured his back doing construction when he was 22, but he needed to keep his job to support himself, so he found a doctor, like at a walk-in clinic, like you can do, who would prescribe pain medication for him. So that enabled him to continue to work. The medication wasn't monitored. He took whatever he needed in order to support himself and keep working. There came a point when the pain was unendurable. He had the wisdom to seek out a primary care provider. That provider helped him figure out what the back problem was and told him the options he could take to remedy it, and the one that would take care of it the most quickly was surgery, so that's what he chose to do. He had the operation. It was very successful. He was relieved of all pain. He was discharged from the hospital with no pain medication because he didn't have any pain. Then he started experiencing symptoms of withdrawal. Now, he knew that this was what he was experiencing because he has a father who has been in recovery, and we've had many discussions about what substance abuse and addiction is like, so he was aware of what was happening to him. He called the primary care doctor and met with him. The primary care doctor was very astute and realized that what he needed to do was give my son some pain medication and gradually, incrementally lower the medication until it was safe for him to go off it completely without the risk of intolerable withdrawal symptoms. So without that primary care doctor, I'm sure my son would now be an addict. And so both for his sake and for society's sake, the role that primary care doctor played was enormous. And I guess that's all I have to say.
Hi, my name is Leslie Ward. I'm from Grand Isle. And my primary care doctor is a naturopathic doctor. And an earlier witness spoke very eloquently on how fantastic naturopathic doctors are. And I just wanted to come here tonight to ask if you would be sure to include NDs in the bill that's before you. I'm hoping it's just a little oversight that NDs aren't in there because there aren't a huge number in this state, and probably the percentage of Vermonters who actually use an ND instead of an MD is small. I ended up at my naturopathic doctor because I had gotten this respiratory, I had a really bad cold that settled into my chest and respiratory and went on and on and on, and I ended up on a couple rounds of antibiotics, and then I ended up with asthma, and I went to an allergist, and I was given the whole collection of inhalers, nose drops, eyes drops, pills, and they worked. But I really didn't like taking all these things, and a friend of mine who was at UVM at the time had heard my naturopathic actually go and spoken to her class, so she said, check this out. And wonder of wonders, I'm off all those medications just by looking at my lifestyle and slowly weaning myself off the drugs and onto a more balanced diet and a few supplements. So I guess the other part that I want to point out is oftentimes it's when I first went to the doctor, she cured me of this whole asthma issue, and then it was like, do I want to start using it as my primary care physician? And my father was a doctor, and so it was a little, naturopaths, and then just going to be too touchy-feely. And so I asked her, well, what if I come down with this or that and I need an antibiotic? She said, well, I prescribe one. Like, was I crazy? And there have been a number of times where she has referred me to other more traditional allopathic doctors for problems that I've had. But a naturopath is just so much more preventative medicine, and I feel like I have probably saved my insurance company and the state of Vermont an enormous amount of money because of the more actively healthy way I live my life now. I don't wait till something's going to come upon me. NDs just really kind of work with you as a whole person and keep you healthy rather than what I consider the traditional doctor, where it's you go in with a problem and then we get it fixed. I think that's also the role of most primary care doctors. So please include NDs in this. It's very simple. You just have to add the little ND after the MD, and you will make many Vermonters very happy. Thank you.
Thank you. So we want to thank everyone for coming this evening. We've heard from 51 witnesses, and I really, truly believe stories that were shared our court member this evening. If you did not get to testify, and there are maybe 10 to a dozen who signed up but did not get to testify, if you have written testimony, please share that with our committee staff. And again, I don't know what the roads are